Module 5, Pediatric Trends. Today, vastly different responsibilities and challenges are present than for earlier pediatric nurses due to the advances in technology and with pediatrics becoming a specialty medicine area. Not only do they receive care from primary care providers, but also schools, clinics, and mobile clinics. Before antibiotics and immunizations, many children died in infancy or childhood. Children were viewed as extra hands to help with chores or provide income for the family. And ill children were often cared for within the home. Hospitalized children were treated as small adults, and mortality rates were high due to the lack of sanitization. Dr. Arthur Jacobi is the father of pediatrics. He opened pediatric units and initiated boiling of milk and isolation of infectious children, which helped decrease childhood hospital deaths. Then after World War I, a period of strict asepsis for newborns and pediatrics was initiated. However, the procedures they were using also led to a lack of stimulation and human interaction with minimal family visits and physical contact. And this unfortunately had a negative effect on survival and relationships. So gradual changes in research has led to major changes. Children are no longer isolated unnecessarily, and interaction with family is encouraged. We also use playrooms in the hospital setting. Current trends in pediatric care recognizes that children should receive care within the context of their families and cultural norms. It's also based on their emotional, developmental, and physical needs. Nurses are instrumental in initiating some of these cost-reducing strategies. Strategies have been developed to reduce inefficiencies in the healthcare system, such as using the correct facility for the correct service, the timing of the service and length of stay, in addition to alternative delivery systems. Strategies also include health promotion and screening. Let's finish it before or complete things before they're needed. It helps reduce costs. Preventative. Case management will monitor and coordinate care and is used to prevent overlapping of services or diagnostic tests. Critical pathways have standardized care plans that are used by the team and provide outcome-based guidelines. They are collaborative efforts of everyone involved. Payment for health services include private insurance and federally funded sources such as Medicaid, state child health insurance programs such as CHIP, and special supplemental nutrition program for women, infants, and children called WIC. Specialized services include Shriners Hospital for Children, Easter Seals, and St. Jude's Children's Research Hospital. Question. The state child health insurance program provides health insurance to which newborns and children? Is it those who are on Medicaid, those who are uninsured, those who are eligible under Title 19, or those who are eligible for care at a Shriners Hospital? Those who are uninsured. So pediatric health today, we look at the child and adolescent health status. Infectious diseases have been replaced with unintentional injury. Unintentional injury includes motor vehicle accidents, drownings, falls, poisonings, and fires. Morbidity is related more to the environmental and socioeconomic issues including school problems, mood and anxiety disorders, suicide and homicide, firearms in the home, drug and alcohol abuse, HIV, AIDS, and effects of the media, developmental problems or intellectual disability, lead poisoning in lower socioeconomic families. So some of the campaigns that have been initiated to improve maternal child health status include the newborn hearing screening and the Back to Sleep campaign, where we put infants on their back to sleep, breastfeeding friendly workplace, and the U.S. Surgeon General's call to action to support breastfeeding friendly workplaces, in addition to the National Immunization Awareness Month. Healthy People of 2020, and that's also moving into 2030, also provide a lot of initiatives for improving the health status of our entire population. And now for your post test.